Right. So this how the format will be. We have a prostate cancer survivor who will be sharing his story with us, and then we have a medical practitioner also in our midst who will be giving us the do's and don'ts, the risk factors, and everything about prostate cancer and how we can overcome it. So on behalf of the section officers, the board of directors of the SP Ghana section, I want to welcome you all to today's diversity and inclusion session on prostate cancer. Without much ado, I'll hand over the floor to the prostate cancer survivor, Mr. Abdul Rafiu Oseni. Mr. Rafiu, over to you, sir.
Thank you very much for the opportunity. I am 74 years old. Hello?
Yes, we can hear you. Yes, we can hear you.
I'm 74 years old and I got prostate cancer 10 years ago. Throughout my life, my only sickness has been malaria. But in 2012, I started experiencing some dribbling in my urine and retention after urination. By then, the prostate cancer awareness was not common. And so I did not know exactly what was wrong. I went to the hospital. There was no urologist to attend to me. And I retained urine even at the hospital, came back home. And in 2013, I was on my way to my hometown, Tumu, and at Wa. In the night, around 12, it was around exactly 12 midnight, I had an attack. I couldn't urinate. The pain was so excessive. And from where I stayed all the way to the hospital was a long distance. There were no taxis. And I was crying like a baby. And somebody helped and called a neighbor who came and took me to the hospital. When I got to the hospital, there was no doctor to attend to me that night. So I was walking up and down like a mad person. Then a nurse spotted me and took me to the emergency ward and inserted the catheter on me. I used the catheter for 6 good years.
Wow.
And I kept changing it every 3 weeks. But I spotted blood in my urine in 2014. Because my wife detected it and said, look, there was some blood there. I reported to the doctors and they put me on some medications. I've been using those medications up to today. But in 2020, the catheter, when the catheter man fixed it, I told him that would be the last catheter I would use. And incidentally, as if God listened to me, I never use catheter again. And I urinate freely. It is a difficult thing because even when I went to Mecca in 2019, as the plane was landing, I couldn't control myself. I had to wet my dress with urine. It's a difficult time. Sometimes you find it difficult to urinate. Other times, the urine comes by itself, it just comes. In the night, sometimes I wake up 15 to 20 times to urinate, and it comes in trickles and very painful. But thank God, I kept my medications religiously. And fortunately, right now, even though I wake up, sometimes I wake up 3 times in the night. When I drink a lot of water, I wake up and I have to discharge. So I put a chamber pot by my bed and wake up. But it's a disturbing period. And thank God you are educating people, enlightening people about this cancer, prostate cancer thing, because most people are not aware. And we don't even know the measures to take to prevent it. But when I started reading about it, I started eating a lot of tomatoes and taking the medics, which I will not mention here. And I've been doing that. And right now, I thank God I've survived prostate cancer. Many of my colleagues who had it have passed on, but thank God I'm still alive. That has been my experience. I've visited all the major hospitals in Accra here. All. I said they should operate. They said, no, you don't need operation. You get well. But thank God I'm alive today. So thank you for this opportunity you have given me.
Wow. Thank you so much, Mr. Abdul Rafiu Oseni, for sharing your story. That someone just passed a comment on the comment section that he's already scared. So I'll quickly summarize what I gleaned from your short presentation. You said you are 74 years of age. You got prostate cancer 10 years ago, and it happened because you were retaining urine. You had no knowledge of it, so therefore you were basically not in the know of what to do. You said in the year 2013, when you were on your way to your hometown to move, you had an attack. That's where you got to know that prostate cancer is what is actually the issue, and then you went to the hospital. You said 6 years for a period of 6 years you were on catheter. So from 2014, you also saw blood in your urine, and you've been on medications till now. You said in the year 2020, you told yourself that this will be your last catheter, and then God being so good, he heard your prayers, and then that has been the very last one you were on. You said it's a very difficult situation to be in, difficulty in urinating. You said at times you also urinate probably 15 times. It is a very disturbing period. You said many of your colleagues have passed on. They couldn't survive this sickness. And then you've been to almost all the major hospitals here in Ghana. Wow, such a story. Thank you very much. Thank you very much. Thank you very much for sharing your story. We'll hand over the floor to or you want to pass a comment?
Yeah, I must add that it is very important that patients check their PSA regularly.
Right.
When they find it unusually high, then they consult the doctor, the urologist who attend to them. Thank you very much.
Okay. Thank you very much, Mr. Rafiu, for your time. I guess you can put off your video now and then just be on standby for us.
Okay.
Right? All right. Thank you very much. I'll hand over the floor to Dr. Douglas Ejapon, who is currently on the line. Dr. Douglas, you can share your screen now, and then you pick it up from there. Over to you, Dr. Douglas.
Can you see my screen, please?
Yes, please. Very, very clear.
Okay.
Yes, we can see you as well.
Okay, that's fine. Good afternoon to everyone. As mentioned, I'm Dr. Douglas Ejapon, and I'm very much glad, happy, and privileged to be here this afternoon and to share a few thoughts on prostate cancer. Without much ado, I'll move on to present my slides. So first of all, I would like to thank very, very, very much Mr. Rafiu Oseni for the experience that he has shared. I am someone who organizes and delivers a lot of health talks. And recently, what we have noticed is that initially we used to deliver health talks using PowerPoint presentations, but we've come to notice that when you introduce the factor of someone who has had the experience, it's very important, and the message drives down better. People really appreciate the condition. People really appreciate the need to take steps to prevent it, because the aim of such talks is to make people aware of the disease and to let people know that you need to do whatever that you can to prevent such an illness. And sometimes when we present only the slides, it becomes more theoretical than practical. But usually when we have people who have gone through the experience, who come to share their experiences, it gives a very emotional touch to it. It gives a human touch to it, and it makes people appreciate it very, very well. So thank you once again, sir. We really appreciate it. And actually, I must say that he has done at least half of my work, because experience, they say, is the best teacher. There's nothing better and there's nothing more detailed than and more practical than someone who has gone through the experience and sharing their experience. So let's see what I also can add. In terms of outline, we are going to go through an introduction, and then we will go through the symptoms of the disease. We'll also go through the risk factors, and then we'll look at the treatment modalities. And then finally, and most importantly, we are going to look at how we can prevent the disease. For my introduction, I would want to talk a bit about what the prostate is, because it's from this organ we are deriving even the term prostate cancer. The prostate is a gland, or the gland surrounding the neck of the bladder. So I have a picture here, and do you see my cursor when I move it?
Yes, we can.
Okay, very good. So this is basically the pelvis of a man. Obviously, you can see. And this figure I'm showing here with my cursor is the bladder. So the bladder is more like the cistern that contains urine. Urine is usually manufactured by the kidneys, which are two bean-like structures which are located at our lower back for every human being. It manufactures urine, and when urine is formed, urine which is liquid, it is collected in this structure we call the bladder, which is like the polytank, let's say, of urine. It gets stored in this particular structure and until it fills up, or until it gets to a particular point that pushes you to feel the urge to urinate. This bladder, a female has a bladder, males also have bladders. Now, after you have the urge to urinate, the body helps you to speak plainly, to squeeze out the urine from this bladder, from this sac, which is called the bladder, through certain tubes that you can see through the urethra. The urethra is contained in the penis, and out of this urethra, the urine comes out. Now, between this bladder and the tube, we have this structure we call the prostate. So beneath the bladder is where we call the neck of the bladder. And this prostate is surrounding the tube that is bringing urine from out of the bladder outside the body. Now, usually when I explain this situation, I try to liken it to using a pen, a big pen. Let's imagine that you take a big pen, and then the cylinder of the pen, you push it through an orange. So you take the cylinder of the pen and push it through an orange. This is the idea. So you have the cylinder of the pen, which represents the urethra, which is a tube. Let's say in practice that the like a PVC pipe that water flows through. So this urethra is the PVC pipe that urine is going to flow through outside the body. And this particular cylinder we are talking about is found in orange. You've pierced through a fruit, an orange fruit, and then you've put this in. I am using big pen as an example, but the urethra is rather flexible. The wall of the urethra, unlike the big pen, which is very tough or hard, the urethra is not like that. It's very flexible. It can easily be compressed by any external pressure. So this is a prostate, and it is found only in men. The primary function of this organ is to produce fluid to nourish sperms. So during ejaculation, sperms are produced by the testes. Sperms are little cells, and these cells are pushed into fluid, and the fluid brings it out as ejaculate. This fluid is produced by the prostate, and it mixes up with the cells to come out as what we see as semen. Cancer is a disease in which some of the body's cells grow uncontrollably and spread to other parts of the body. So if you are able to break down the whole body into the simplest unit, you would realize that the body is made up of little units called cells. I liken it to a building. You see a whole building, but then if you break down the building, you realize that there is the smallest unit, which is, let's say, the cement block. So these cement blocks, which are the cells, are the ones that have been built together to give you the big structure, the human being, which I'm likening to a building. These cells, when they multiply, when they aggregate and they multiply, is what gives us growth. So since childhood, as we grew up, growing up simply meant that the cells multiply. And because when they multiply, they give a lot of mass and matter and content to the body is seen to enlarge and growth occurs. Growth is supposed to occur in unison. The whole body is supposed to grow together. You can't have the head becoming big or growing up whilst your chest remains small. If that had happened to us, you can imagine how we'll be looking like. Imagine that you still have the size of your trunk as it were when you were a baby, but then your head has grown as the ages pass by. This will make us look funny. So growth is supposed to be holistic. Every part of the body is supposed to be growing together. But what cancer does is that cancer makes a particular part of the body grow as the other parts of the body remain the same. It causes the one part of the body to grow at a rate which far outweighs the rate of growth of all the other parts. So if we say you have a cancer of your finger, let's say, it means that for some reason, the growth of the cells of your finger have lost control. Growth is occurring abnormally at a very abnormally high rate, more than the growth of the rest of your body. So when you look at the person's finger, you will notice that usually it's swollen. That is when usually we call it a tumor. Sometimes the growth is too excessive that it breaks down. So then you see sores at the particular site where cancer is located. And these sores usually we call ulcers. This is the meaning of cancer. So if we are talking about prostate cancer, then it means that we are saying that the cells of the prostate organ, which we described earlier in this picture, have gotten into a state out of control and they are growing abnormally. And usually when they grow, they don't only remain at their post, they also spread to other parts of the body, because you have the blood that is circulating throughout every part of the body. And usually when it carries substances at one particular point, it transfers those substances to another point. So you have the blood that gets to the prostate and then finds some of these cancer cells, and then it carries them and it moves them to some other parts of the body. So if not controlled, you notice that the cancer cells have grown and have affected most parts of the body. It's important to note that talking about prostate cancer, it's different from BPH, which is benign prostatic hyperplasia, and then prostatitis. Usually people mention prostate cancer and we generalize it. Usually we talk about prostate issue. Once someone says they have a prostate problem, we have the notion that it's referring to cancer and nothing else. No, there are different types of prostate problems. We have the benign ones, which is not cancerous, which has similar symptoms like the cancer, but it's milder. It's the benign prostatic hyperplasia. And then we have the infection of the prostate, which is prostatitis. This is for you to note that these two are totally different from prostate cancer. But for this particular session, we are dealing mainly with prostate cancer. So we'll focus mainly on that. Prostate cancer affects about 60% of Black men. It's a leading cause of cancer-related deaths in males in Ghana. It's estimated that out of every 100,000 males, you have 200 dying from cancer. 80% of death, meaning usually when people are diagnosed of prostate cancer, 80% of them usually will die out of the disease. And usually this diagnosis or this death is attributed to late diagnosis. People don't usually notice it early. By the time they notice it, the cancer has spread and it easily leads to death. This is the picture for Ghana. Now, globally, 1 man in 8 will be diagnosed of prostate cancer in their lifetime. And then prostate cancer is the second leading cause of cancer death in American men. This is just to also give you a global idea. The first few list of statistics I gave was specifically for Ghana. So this picture gives you the idea that prostate cancer, it's a burden, it's a problem, and it's something that has to be tackled and dealt with. So now I move on to talk about the symptoms of the disease. And I would want to use this picture to elaborate the symptoms because I like this approach because when I do it like this, it makes listeners appreciate it better. After using this particular approach to elaborate the symptoms, then I may go to the next slide where I will talk about other symptoms which may not come up here. So back to the scenario I gave you at the beginning, where I was talking about a big pen, or let's say a straw used for sucking juice or something, a straw found in an orange fruit, or you can also imagine a straw pierced into a balloon. Anyhow, but I hope that you get the picture. So the process starts like this. You have the sac, which is the bladder, which contains urine. Urine is supposed to accumulate and give you the urge to urinate. Now, if you have cancer in this prostate organ, then it means that from the definition and explanation of cancer I gave you, this prostate organ is growing abnormally and is becoming bigger and bigger. Once it starts becoming bigger and bigger, it means that it starts to exert pressure on the tube, which is found within, or the straw. So the balloon is exerting pressure on the straw within. Once it's exerting pressure on this tube within, it means that it's occluding it. It's closing it up. That simply means that if one gets the urge to urinate and one begins to empty the bladder or to squeeze the bladder, the urine which will be coming out will meet some resistance within at the part of the tube which is within the prostate. So the symptoms will usually be like this. The person will notice certain urinary symptoms. One of the first symptoms we call hesitancy. So hesitancy is, you know, the usual. You feel like urinating, immediately you get to the toilet, you open up, you push, and then the urine is coming. But this time you get to the toilet, you open up, and then you start pushing, and then there's a delay before the urine will start pouring out. And this is simply because of the resistance it's meeting, because the prostate has become bigger and is exerting pressure on this tube, which is supposed to give you free flow for the urine. Then the other urinary symptom you may find is what we call poor streaming. By poor stream, it means that the flow of urine is going to be very much reduced. So initially, you knew that you would push and within seconds you are done urinating, but this time you would push and it takes a longer time before you are done urinating because the flow is very much reduced. It's called poor streaming. Then you also will experience symptoms of straining. You strain much more in order to achieve urination, or what we call micturition, as compared to how it used to be. Because again, you are meeting resistance. The urine coming out is meeting resistance. So you'd have to push much more than you usually would have pushed. Then we also have the feeling of dribbling. Because of the poor streaming, at the end of urinating, this usually will cause some retention of urine. Because there is resistance, after you have finished urinating, you will notice that there's still some residual amount of urine in your bladder, which means that after you have urinated, within a short while, you feel again the urge to urinate. Initially, you would urinate, and after 4 hours before, you would feel the urge to urinate again. But now you realize that you urinate, and then after 30 minutes, you already feel like urinating, simply because the initial amount of urine did not all get evacuated. So in a short while, it has filled up again, and then you feel like you want to urinate again. This residual content of urine also causes what we call the dribbling. It means that after you have urinated, you go, you dress up, and then you go, and then later you realize that some amount of urine has still dropped into your underwear. So when you go again to urinate, you realize that you have some urinary smell coming from your underwear just because you dribbled. Then also, I've already talked about the incomplete bladder emptying, which means that you often would feel the urge to urinate at shorter intervals than you would have initially. This retention of urine sometimes can come out very dramatically, and that is one of the things Mr. Oseni talked about. And usually, this will be the first presentation of the patient to the hospital, because usually the patient would have experienced these urinary symptoms in a mild form, but may not have ever presented to the hospital because they may overlook it. But the day comes when one night, and it often occurs at night. So one fateful night, you have the poor man who sleeps and the urine gathers, never feels the urge to urinate. And then before they realize, their bladder is really, really full like you have overinflated a balloon. This is very painful. This kind of pain is described as one of the most painful events that any man could ever face. Actually, even though no man has undergone labor to give birth before, men usually would compare this pain to giving birth, and would usually say that this is the most painful event ever. And if women say that labor pain is usually their most painful event ever, they would liken this kind of pain to labor pains. Men usually come in high levels of distress, have very, very high levels of distress. And most men, when they appear, are crying. And this tells you how much painful it is, because you know men usually would prevent themselves from crying, but they usually will come out crying and come with a sense of doom, wanting and pleading help, immediate help. And at that particular time, if they won't get help immediately, it's very distressful. At the hospital, normally, we pass a catheter. Sometimes you try to pass a catheter even through the urethra, through the penis. Because of the resistance, you are not successful. So sometimes you have to pierce the catheter through the lower abdomen, through the skin. And it's very comforting to see the instant relief that the man will typically have after this insertion of the catheter. Another urinary related symptoms that they would often encounter are symptoms related to infection, because once you have urine stay in the sac for long periods, they usually catch infection, and infection comes with fever. It comes with irritation of the bladder, which will cause lower abdominal pain. It comes with increased feeling to urinate, and the urgency. You feel, once you feel like you want to urinate, you feel the urgency to urinate. It's like if you don't pass the urine, you are likely to pass on the urine on yourself uncontrollably. And these are the usual symptoms of prostate cancer. So having used this diagram and the illustrations I gave to explain the symptoms, let's go and see other symptoms. We have general symptoms. Just because it's a cancerous illness, we have general symptoms, which are malaise, because cancer is an event that drains the human being. having your cells grow uncontrollably at high rates, abnormally high rates, means that it's sucking a lot of energy and food from the human being. So this brings about some general symptoms that every person with cancer will encounter. The first thing is malaise, the general feeling of not being well. The second is the easy fatigability. You realize that with a little effort, with a little work, you feel fatigued, you are tired, and you want to rest. Unexplained weight loss is a common feature. For the urinary symptoms, I've talked about most of them from the diagram. The only thing I'll add here is the blood in urine, because you usually have ulcers in the cancer, like I mentioned, sores. Someone you would urinate and then you notice that there's blood in the urine. There are also erection or ejaculation related symptoms. You can find blood in semen or ejaculate. One can notice difficulty in obtaining erection. One can also notice painful ejaculation. You ejaculate at the end of sexual intercourse, and then you realize that it's very painful. If the cancer has spread, so what I've mentioned are the primary symptoms of prostate cancer. But if the cancer has already spread to other parts of the body, then it means that we call on other symptoms based on the other parts of the body where the cancer has already spread to. So if the cancer has spread to the bones, and typically it spreads to the backbone, the spine, and the spinal cord. If this has occurred, it means that you will have pain in the back, pain in the hips, pain in the thighs, pain in the shoulders, and pain in other bones. If it has spread in the blood and down the lower limbs, one can experience swelling or fluid buildup in the legs and feet. If it has spread to the abdomen, to the gut, and to the liver, you can experience change in bowel habits, meaning that either you're having too much of diarrhea or you can end up even having too much of constipation. If it has spread to the lungs, you can have cough, difficulty in breathing, hemoptysis, which is seeing blood in your cough. You cough, you bring out sputum of phlegms, and already you can see blood. If it has transferred to the chest again, it's possible you can experience pleural effusion. Pleural effusion is when you are not able to breathe and we tap your chest and we realize that there's a lot of fluid accumulated there. And this fluid is fighting with your lungs for space, so you are not able to breathe properly. If it is found at your abdomen, you can have abdominal distension. So you may have someone who comes across with a very big tummy, and this may be from prostate cancer. If it has spread to the liver, it can cause symptoms of liver disease like jaundice, again, abdominal distension and abdominal pain. There are many more other symptoms that can occur as a result of spread, but these are the usual ones. At this point, let's look at the risk factors. What causes prostate cancer? Here, let me try and elaborate the difference between when we say causes and risk factors. Causes are usually direct in nature. Like we say that if a mosquito that is infected with malaria bites you, it causes malaria. This is very direct. The causing agent, the relationship between the causing agent and the effect, which is the disease, is usually direct. And it is almost always the same event that causes it. It means that there's no other means someone can get malaria usually, aside being bitten by a mosquito which is infected by malaria. So when we speak about causes, that's what we mean. We mean that we are able to identify a clear causative agent that is causing the disease. And almost always, once you see the disease appearing, it means that it may have been caused by that causative agent we are talking about. This is the meaning when we say something is causing a disease. But when we begin to talk about risk factors, and there are certain diseases that don't usually have causes, but rather risk factors, it means that we have identified certain factors that are usually associated with the disease. It further means that when you find the disease and you try to trace the risk factors, once in a while, you will find that someone may have that disease without any of the risk factors we are talking about. However, the person has a disease anyway, but we are trying to say that if we mention a particular event as a risk factor, it simply means that if you take people, 10 people, for example, here we are going to talk about family history as a risk factor. What it means is that if you take 10 people and out of the 10 people, you have 5 who have a positive family history for the disease and 5 who do not have a positive family history for the disease. It means that out of the 5 that have the positive family for the disease, about 4 will end up having the disease. But out of the 5 that have a negative family history for the disease, only about 1 will end up having the disease. So risk factors mean that if you're talking about the disease, they are usually associated with certain events. And these are the things we are going to talk about. What does it also further mean? It means that when we mention something as a risk factor, if you find yourself in that category, you should be extra careful. Everything that we are going to mention as a preventive measure is something that you should really take seriously, because your chances are higher to develop the disease over another person who does not have the risk factor. But it also implies that when we mention a particular category and you are found within that particular category, do not be afraid. Do not fear, because it does not necessarily mean that because you are found in that particular category, you will end up having the disease. It's just about being cautious. So let's then look at the risk factors for prostate cancer. Male gender is the first risk factor, because prostate cancer, unfortunately, or fortunately for women, does not occur in women. If we are talking about an issue like breast cancer can occur in men, but when it comes to prostate cancer does not occur in women, because it is only men that have prostate. So just the fact that you're a man increases your risk of developing prostate cancer. The age is another risk factor. Beginning from 40, one begins to have prostate-related issues, but from 65 years, your chances of getting prostate cancer specifically increases. Prostate cancer is much more prevalent in the Black race as compared to the Caucasians. It means that once you are Black in color, your chances of having prostate cancer is higher. As already mentioned, family history is also a strong risk factor for prostate. Once you have a relative you can trace by blood, a father or an uncle or a grandfather, be it from your father's side or from your mother's side, once you have any of them who has had prostate cancer before, it means that your chances of developing prostate cancer is high. It's also interesting to note that if you have a female relative, a grandmother, auntie, or other that has developed breast cancer or ovarian cancer before, it means that you are also at risk of developing prostate cancer, because the gene, which is the BRCA gene, which has been noticed to be associated with this breast cancer and ovarian cancer, has also been associated with prostate cancer. So if you have a family member that is a female that has had any of these cancers, they can pass on this gene to you and you can end up developing prostate cancer. Obesity is a risk factor. Poor eating habits is another risk factor. And then smoking is another risk factor. Here, let's talk about treatment. I'll run through this very quickly because it's not our priority. The major aim of even discussing treatment is to let you know, because the treatment comes with some complications, and it's important for you to see the severity of the illness, that it is not just about even the symptoms, it transcends the symptoms and even goes further to the treatment, because just the treatment modalities also has their own issues that they bring about. So one of the treatment modalities could be observation, and this will be determined by the doctor. If the partial diagnosis has been made, it has been noticed that you have prostate cancer, but the diagnosis is not so convincing, or if it is at the very elementary stage, we can't decide to observe. We'll just monitor you closely and not make any intervention like giving you drug or otherwise. Chemotherapy is one of the treatment modalities. The man on the right is undergoing chemotherapy, and chemotherapy basically means giving you cancer killing medications, usually passed on either orally or given through the infusion, the IV fluid. Chemotherapy comes with its complications, which include fatigue, hair loss, mouth sores, nausea and vomiting, diarrhea, reduced immunity. Reduced immunity means that any other infection can also attack you, like you have HIV/AIDS, easy bruising and bleeding, loss of appetite, and then the destruction of the gonads. The gonads are the testes. It means that once you are undergoing chemotherapy, there's a chance that if you can become eventually infertile. Then the doctor, based on your diagnosis, based on your stage, because usually the disease will be staged. The staging usually will be made based on where it is located, whether it has spread or not, the severity. So based on the stage and your condition, so this is to note that the treatment for prostate cancer is not single for everybody. It's not one size fits all. Based on your condition, based on your type of cancer, you may undergo certain treatment which another person may not undergo. So radiation is another modality. Usually you stand in front of a machine and you'll be bombarded with nuclear substances. Complications include bowel problems, bladder cystitis, that's irritation of the bladder causing a lot of lower abdominal pain and urinary problems. It can cause urinary incontinence. Incontinence means that you don't feel the urge to urinate the moment you realize you've already passed out urine. And this can also be a symptom of prostate cancer. Mr. Oseini, when he spoke about this as well. The radiation therapy can also cause erection problems, can cause fatigue, and it can cause swelling of the body, which we call lymphedema. You may also undergo hormone therapy. The hormone therapy, because we have noticed that the hormone estrogen, which is actually the hormone that makes a man, is a high contributory factor to making prostate cancer grow. So sometimes you may be given medications to stop the effect of these hormones on your body. Or you may undergo chemical castration. It means that they will have to take away your testes, because the testis is the organs in the human body, in the male body, that produces the estrogens. Sorry, I'm talking about androgens. Estrogens, I correct that. Estrogens are for women. I'm talking about androgens, testosterone, which is for men. And in the body, the testicles mainly produce the androgens or the testosterone. So sometimes when the cancer is very aggressive, we may have to do surgery and take away your testes so that we can reduce your levels of those hormones which are being produced, because if they are being produced, they will increase the rate of spread of the cancer. Hormone therapy also has its complications of decreasing libido, causing erectile dysfunction, shrinking of the testis. That is if we are using the drug hormonal therapy, shrinking of the penis, causing development of breast, increase in size of breast of men, anemia, weight gain, fatigue, increased cholesterol levels, depression, decreased mental sharpness, and loss of mass. And you know, these are things that usually men find demeaning. Men usually, I mean, once a man, even as old as he is has reduced libido, erectile dysfunction, and has problems developing breast and all, it goes a long way to affect the mental health of the man. Usually men become depressed at that stage. There's a funny story, the usual story, where men come to the hospital when they are undergoing some of these treatments and they begin to complain about erectile dysfunction, and the man is 70 years and is complaining about erectile dysfunction and wants support. And sometimes you have the nurses around who are laughing and wonder what the man will be using an erection for at that age. But hey, probably someone in retirement, that may be before such a disease, the person may have had a lot of strength, and that's maybe one of the few pleasures still being enjoyed in life. So these are real issues we are talking about, and they are really affecting men. Another treatment modality is the prostatectomy, in which we'll have to take away the prostate altogether. Then supportive treatment is also very much important. Supportive treatment is any other treatment modality we use to support you. It means that if you have anemia, we'll have to give you hematinics to boost your blood pressure. If you're not able to urinate, we'll have to pass the catheter, which Mr. Oseni mentioned. Catheter is a very uncomfortable instrumentation. We basically pass a tube through your penis in order to go through and bypass the resistance being met by the prostate. So we pass that tube through the penis, through the urethra, the tube through which the urine comes out into the sac, which is the bladder, so that the urine can freely flow out for you. Once we insert a catheter, it means that you usually will be going to the hospital often for changing. You may go as often as 1 week, and changing catheter is a painful thing. We will have to pull the catheter. It's rubber-like. We'll have to a rubber-like tube. We'll have to pull the catheter and insert a new one. Sometimes it comes with bruising of the urethra. People bleed. It's a very uncomfortable feeling. And once we start you on catheter, we never know when you'll be catheter free, because once we put in a catheter, we often do what we call the trial of urine. We pass in a catheter because you cannot urinate on your own. So occasionally, we will take out the catheter and then we'll ask you to try to urinate on your own. Some people pass the test, they're able to urinate on their own, and then we say, okay, let's take you out of catheter for a while. Unfortunately, these people, after you've taken them off catheter, later, after months, become dependent upon catheter again, and they have to come back for you to reinsert it. Some never pass the test, so you always have to keep inserting the catheter. It comes with it, all the other discomfort. You can imagine this is very distressful for every man. And the idea that you always have to go and expose yourself to probably a nurse to always have your genitals played with. What we are trying to say is that the burden of the disease, the discomfort of the disease goes just beyond the symptoms. Even the treatment modality poses a lot of challenges. So to the last portion, which I always find the most important, because it's always prevention, we say, is better than cure, and it's always better to give the tools to prevent than to have someone to develop the disease before you come and treat it. So here I dwell on prevention, and then when I go through, you also notice that it's clear. The principle is that once you know the cause of a problem, you already have the solution, and many of these preventive measures I'm going to mention are derived from the risk factors. And the idea is that if this is causing this, then it means that you need to prevent this in order to prevent the disease ultimately. So the first preventive measure I'll give you, which I've already mentioned, is be cautious. If you find yourself in any of the risk factors we have spoken of, be extra cautious. If you're a male, if you are Black, if you are getting old, or if you have a positive family history, if you have any of these, or even the combination of all, then please be very cautious. Whatever we are saying today is very important to you, because it means that your chances of getting prostate cancer is very high. Do not be scared, but be very cautious. And do not be scared also, because the principle of treatment of cancer is the fact that once we identify it early, treating is very simple. The problem and the burden of cancer usually comes, or mostly comes, when we don't identify it early. Maintain a good lifestyle. Exercise very often. These are things we've mentioned over and over again, and you'd observe that lifestyle modification is a particular tool that when you are able to exercise, it saves you from most diseases. So exercise often, eat well, eat fruits and vegetables, eat diet low in fat, eat diet which contains healthy fat, eat diet which contains low sugar, lean proteins, low dairy, less milk, less of dairy products, and then avoid smoking. Of course, healthy diet is also another topic on its own, which we can discuss another time, but it's important to know that once you are eating healthy, you are preventing prostate cancer. Maintain a healthy weight. Make sure that your BMI is not going beyond 25 kilograms per meter squared. Then once you are 40 years and beyond and you're a man, it's important to undergo a PSA test. The PSA is the prostatic specific antigen. It's a blood test and it's a marker of cancer, prostate cancer. It's important to do it yearly. Every year, usually the normal value is 0 to 4. So every year it's good to go to the hospital and have this tested and to make sure that it's within normal levels. Because usually if before, as a precursor to cancer, you would realize that you have the PSA level above 4. Once it's above 4, it lets us know that there's a problem with the prostate. Even if it's the others, I was talking about the benign prostatic hyperplasia, which is benign. Usually we'll notice it from the PSA. So it's important that every man below 40, it may not be so beneficial to you, but once you are 40 years and above, please write it somewhere that you need to have your PSA test every year. And do it with a doctor, because sometimes you may also have to undergo ultrasound scan, a pelvic scan of the prostate. As you can see on the right, you can see someone who is being scanned. So it's also very important because sometimes you will do the PSA and the PSA will appear normal, but prostate cancer may be existent, but the scan can pick this cancer. This actually is, in a nutshell, the preventive measures that you can take to prevent prostate cancer. And it's important, as we say, prevention is always better than cure. So to conclude, I repeat that since every female has an important male figure in their lives, that is a father, a grandfather, uncle, son, brother, or etc., prostate cancer is not only a concern for men, but for women as well. Is there really no weapon to fight this battle? I believe that the answer is yes, there is, or there are weapons to fight this battle. And I hope that this afternoon, I've been able to equip you with these weapons to fight this battle. Thank you very much for your audience, and I am very much ready for your contribution and your questions. Thank you.
Wow. Thank you so much, Dr. Douglas Ejapon, for this very insightful presentation. Already the questions have started coming in. I see Francis Owusu's hands raised. To I'll give him the opportunity to ask the first question. Mr. Francis, you can shoot your question.
Yeah, good afternoon, colleagues, and good afternoon, doctor.
Good afternoon, Francis.
Yeah, thank you so much for your presentation. It's really healthy. Please, I would like to find out, is there any difference between prostate enlargement and then prostate cancer? Thank you.
Good question. So prostate enlargement simply means your prostate has become bigger. And there are causes of prostate enlargement. The causes are, first of all, an infection of the prostate, which we call prostatitis, like I mentioned earlier. The other cause is the benign prostatic hyperplasia, which I mentioned earlier, which is another cause of enlargement of prostate, but is benign, it's not cancerous, and it's easier to deal with. Then the last cause of prostate enlargement is the prostate cancer. So the difference is that prostate cancer is one of the causes of prostate enlargement. Usually we mention it as a regular language, prostate enlargement, but when we go into details, then we find that there are various causes of prostate enlargement, which includes prostate cancer.
Okay, thank you, doctor.
You answered.
Yes, please.
Good.
All right. Any other question from our audience? We've looked at the introduction. He then moved on to symptoms such as poor streaming, straining, feeling of dribbling, incomplete bladder, emptying, etc. He then gave us the risk factors, treatment, and then prevention. He then ended on a good, on a note, since every female has an important male figure in their lives, a father, grandfather, uncle, brother, son, prostate cancer is not only a concern for men, but for women as well. Is there really no weapon to fight this battle? Food for thought. I can see Mr. Nicholas Abaka is showing hand up. Mr. Nicholas, you can please ask your question.
Thank you very much for this session, SP Ghana, and also thank you, Doctor, for granting us this time with you.
Most welcome.
My question is,
thank you very much, Shina, for bringing Doctor on board.
Okay. My question is a general notion out there. I don't know whether it's a skeptic notion or it's a scientific one. People mostly talk about or associate prostate cancer to too much or prolonged abstinence from sex. But then I've not seen any connection that you've done with it. So I want to know if there is a connection between those two.
I see. On a lighter note, the virgins, you want to say the virgins are prone to prostate cancer, Mr. Nicholas?
In the
nutshell,
Yeah,
it's an often said I don't know, I can't call it a fact. It's something that people usually mention. It's all over social media, and they encourage, they actually use it to discourage boys who decide to be virgins, to tell them that, look, if you're not having sex, you're increasing your chances of getting prostate cancer. But scientifically, I have not come across any evidence for this. It may be true, but from the medical point of view, I've not come across any evidence for this. What prostate cancer, the relationship between prostate cancer and sex is what I've mentioned. The fact that prostate releases fluid for semen, and then if you have prostate cancer, it can affect your ability to erect, and it can also affect your ability to ejaculate. So, Nicholas, unfortunately, I don't have any scientific data to back this, so I cannot I cannot justify, and I cannot confirm it.
You can't confirm or deny.
Exactly.
Much,
oh,
thank
okay.
you very much, Doctor.
It's rather unfortunate. But thank you for the answer.
Welcome.
All right. Mr. Adam, I can see your hand up.
Yes, thank you very much. First of all, Doc, thank you so much for the nice presentation.
Welcome, madam.
Thank you. So, Doc, I mean, in your presentation, you did mention that there is this a distinction between prostate enlargement and then prostate cancer itself. You said up to 40, somebody might have prostate enlargement, but that is completely different from prostate cancer. And the prostate cancer, when you were talking about the risk factors, you mentioned the age from 65 and above. I just want to know if there is any connection between prostate enlargement. Let's say somebody who is younger, somebody who is 42 years today, okay, has prostate enlargement. Does it mean that when this person eventually goes to 65, he is likely to get that? If you can help me. Thank you.
Okay. No, not necessarily. The fact that someone has prostate enlargement does not necessarily mean that the person will go on to develop prostate cancer. Just that some research has identified BPH, which is the benign prostatic hyperplasia, and then chronic prostatitis, which are both causes of prostate enlargement, as a risk factor to prostate cancer, which means that in a small percentage, having prostatitis, untreated prostatitis, and prostatitis, I must say, is difficult to treat because the prostate, blood flows to every part of the body, every organ, but the prostate is one organ that is a bit isolated from blood. So when it has an infection and you give antibiotics, the penetration effect of the drug is quite limited. So it's difficult to treat infections of prostate. So once you have continuous untreated prostatitis, there has been some evidence, little evidence that that one and then the benign prostatic hyperplasia can move on to prostate cancer.
Right. Right.
Thank you, Doc.
But it's
Thank
not
you.
a high chance here.
Yeah, thank you.
Just to reiterate that our survivor is also online. So in case you have any question for him, he'll be willing to answer. Any experience you want him to reiterate, he's available online. I can see Mr. Daniel Opon's hand up. Please shoot with your question, Mr. Daniel.
James, what's up?
Fine, thank you, sir.
All right, so I wanted to find out that, usually he said that by 65, that's when the prostate cancer begins to show up in a man's life. But you go to the hospital and men around 35, 40, 45 are contracting or suffering from this prostate. What is the definitive age bracket where you can say men are very susceptible to this disease?
Okay, Daniel. So I think that is what I was trying to explain when I was trying to elaborate the meaning of risk factors and how different it is from causes. So if you remember, I mentioned that when we say something is a risk factor for an outcome like a disease, it means that if somebody finds if somebody finds himself or herself in that particular category, the chances of developing the outcome or the disease is very high. But it also means that you may have someone with a disease, you look back and then you realize that the person may not be found in any of the categories of risk factors. It's a small percentage of it, but it happens, which means that the age brackets we are given, and I'll state them again, above 45. So note it very well. From 40 onwards, you should start checking your PSA levels. From 45 onwards, there's a high chance of developing prostate problems, not prostate cancer, prostate problems, which includes benign prostatic hyperplasia. From 50 years and above, your chances of getting benign prostatic hyperplasia increases. Then from 65 years and above, your chances of getting prostate cancer also increase. These are the risk factors. They are risk factors. What does it mean? It also means that you can find someone who is not in any of these categories, not above 40, not above 50, not above 65, who already has prostate cancer. These ones are unexplained. We don't know the reason. We may or may not know the reason. It means that it could be that you may find someone who is 35 years and already has prostate cancer. And it could be that maybe this person has prostate cancer, not because of the age risk factor, but because the person has a family member that has prostate cancer. Or it could be that you find someone who is at 35 and you investigate and the person has no risk factor, not in any of these categories, and the person has prostate. It's usually called idiopathic. And in disease, determining causation of disease, we always allow room for idiopathic, which means sometimes we admit that the person has the disease and we obviously do not know the cause. So that's the explanation.
All right.
I hope it's clear.
Okay. Thank you very much, Doctor. I'll ask this one. Can you please throw more light on the PSA? What is PSA?
Okay, PSA, the full meaning of PSA is prostatic specific antigen.
Right.
One thing we have noticed is that every organ in the body releases a particular part of it into the blood. And once we test the blood, we usually will find that bit. Let me try and give an example. If you have a pipe and this pipe, you put a pebble like toffee kind of pebble, the one that gives off a lot of color when you put in your mouth, let's say. Sorry, I like using a lot of practical examples. If you put pebble, or let's say if you put something that contains color like blue,
Right.
age-old blue used for washing and give white, if you put it in a pipe with water flowing, if you put it at one end and you go to the other end, you may find that the color of the water is blue. The substance may not have dissolved completely, but then you find traces of particles of this substance in the water at the other end. So this is the idea. So the idea is that every organ, the liver, the prostate, everything in the body gives off particles of itself into the blood. And when you test the blood, you will find these particles, and it's a marker of the presence of that particular organ. Now, when the organ is diseased or has cancer, it gives off more of that substance that it is releasing into the body. So this prostatic specific antigen is a protein being released from the prostate into the blood normally. On a normal day, this mechanism is ongoing. The prostate is always releasing a part of it, which is the prostatic specific antigen, into the blood. However, once this prostate becomes diseased or undergoes cancer, per principle, it begins to give off more of this substance. So when we measure, we take the blood sample and then we measure the levels of this antigen in the blood. If the levels are within the normal limits, which is the 0 to 4 nanograms per milliliter, then it means that it is just a sign to show that prostate exists in this human body, but then this prostate is not diseased. But once we realize that the levels are going above the limit, allowed limits, then it gives an impression that the prostate is diseased. And that is the reason why it's giving off much of this. So every year after 40 years, we advise that you go to the lab and then you have your blood sample taken to be tested for this prostatic specific antigen. And if it is found that it's higher, it could be that the prostate is diseased. And diseased means it could be that it's an infection, or it is prostatic hyperplasia, or it's cancer.
Right. Can you also please throw more light on prostate reducer, or what is known as prostate reducer?
Prostate reducer. Do you have, maybe just, you can just quickly tell me what you have heard, because it's not really ringing. You know, we have a lot of jargons and a lot of common language that we use that sometimes medically, it may not. Did you have any idea? Just a little idea, and I think I can explain if I have the concept.
It's someone that shared it on our page. He was he said, I guess having a prostate reducer is very key. When he saw the title. Yeah, so I didn't know what exactly it really meant by prostate reducer is very key. But yeah, that's fine. That's fine.
I mean, I'm happy to have I also learn from these presentations. So if the person is,
let me ask if
it's important for doctors to always know what the commonest think. I mean, what's the lay person has in mind. Okay. So that if there are any misconceptions, we can clarify.
Mr. Robert, are you online? I don't think so. Yeah, so we can move on.
Okay. But okay, so just quickly, I just went online to try to find out what the concept is, and it seems that there are certain food substances that people push as substances that are able to reduce the size of the prostate and are able to cure prostate. So people have mentioned leafy vegetables, tomatoes. Yeah, they have been identified to be certain substances that when you eat them, they help to reduce the size of the prostate. My answer to this is I do not doubt it. Actually, I do not doubt it. I have read researches on these, and I think that scientifically it could be true. Only that we speak from the orthodox medicine point of view, and from the orthodox medicine, usually we don't preach or we don't push these things. We just say in general that eat fruits and vegetables, natural organic fruits, and every fruit or vegetable you eat has a nutrient or a substance that goes a long way to contribute to your general well-being and even to the prevention of diseases like prostate cancer. But we acknowledge that orthodox medicine is not the only form of medicine that exists. We have herbal medicine, we have Chinese has, the type of medicine, and some of them are backed by research, and some of these substances have been found out. I cannot speak so much to it, but the advice I can insist on and really emphasize is fruits and vegetables all the way. They are very important.
Right. Thank you very much, Dr. Douglas. Any other question from anyone? Okay.
Yeah. Hi.
Yes, please go on.
Yeah, please. Just to ask Doctor, maybe if someone wanted to see him personally, or maybe at his workplace, which hospital or where can we locate him?
All right.
Thank you.
So over to you, Dr. Douglas.
Sure.
Some people want to come one-on-one consultation.
Yeah. So currently, I'm working for Any Ghana. I'm a medical doctor for Any Ghana. Unfortunately, at Any Ghana, the clinic is very much limited to only the employees and the staff. So I'm not allowed to do consultations there for persons who are not employees of the company. However, personally, I do consultations for people. I'm very much available. So I can give you the permission, coordinator, after the
please shoot
the meeting.
Okay.
I can put my I don't know if I should put it on the chat.
Yes. Once you're done talking, you can drop your email in the chat box for us all.
Okay.
Right.
I'll do that so that anybody, I think anybody who wants to reach out to me, I'm very much available. Everybody knows me. I'm very much open. I'm very much ready to help as much as I can. I will. I'm doing that right now, actually.
All right. So for those of us that didn't get where he said he works, Any Ghana, we call it ENI Ghana. So he's a medical doctor for ENI Ghana. He consults for them. And he is also available for private consultation as well. Madam Letitia is asking in the chat box, can abuse of sexual enhancing drugs increase one's risk of getting prostate cancer? Doctor, over to you.
Yes, some research has also found this, that yes, if you are abusing sexual, because as we have already mentioned, the prostate is a significant organ when it comes to sexual intercourse. So once you have sexual enhancers, and you know that currently many sexual enhancers are drugs which have not been controlled by science. They usually are off the radar of the FDA. A lot of youth of today have many products, herbal products, many products that sometimes they even come up themselves, and they use without limits, without the right dosages, and they just use them to enhance sexual intercourse. And because it's uncontrolled, it's having effect on your testes, it's having effect on your penis, it's having effect also on your prostate. And some research has found that excessive use and abuse of these sexual enhancers for men can, in a way, be a cause for prostate cancer. Yeah. So,
All
I mean,
right.
it's good. It's important she mentions it, and it's good that we should. Letitia is one of my able nurses, very, very knowledgeable nurse. Thanks to her for this question. It brings in another element.
Thank you very much. Thank you very much, Doctor, for that answer to the question. I would like to then call on Mr. Mr. Osani, the survivor, to probably share any last words he has for us. If not, we can move on. So, Mr. Abdul Rafiu, please, are you online? Hello, sir.
Hello?
Yes. Can you hear me?
Yes, I can.
Okay. I was asking for your last words. Most people missed your presentation, so your last words to us will be very much appreciated.
Before I give you my last words, I want to ask Dr. a question.
Yes, please shoot.
Is there any relationship between masturbation and prostate cancer?
Wow.
Okay, not that I know of. Not again, no scientific evidence that I know of. I mean,
Thank you very much,
between
Doctor.
masturbation and prostate cancer, yeah.
Right.
Unless again, masturbation is being done with these sexual enhancers, which I've already spoken about.
Yeah.
But if it's being done with lubricant or something that is basically replicating natural sexual intercourse, I don't know of any evidence that supports that it causes prostate cancer.
All right.
Thank you very much.
All right.
For this opportunity. I ask all the audience or the viewers to take the symptoms seriously. If they see any of them, they should consult their doctors, because prostate cancer is a very painful experience. I don't wish that thing for my enemy.
Wow.
Thank you for the opportunity.
Wow. Thank you
very
too.
much,
Thank
sir.
you too, Mr. Abdul Rafiu. Thank you. Thank you. Thank you. Over to you, Dr. Douglas, for your last words.
No, thank you. I just want to say thank you all very much for the audience. Thank you for the opportunity. I hope that I've made an impact, which is, of course, the goal, should be the goal of every human being. I don't think I have anything more to say to that. Thank you. Thank you so much.
All right. Thank you. Thank you very much. We have our session chair in the person of Dr. Revison Opon. So I'll give him the opportunity to also give us his last words. Dr. Revison.
Yes, James. Thank you so much. Thank you, Dr. Douglas and Mr. Oseni, for making time to come speak with us. And I think, like everybody else, this is very educative to me. Learned quite a lot of stuff, preventive measures and early cure. I'm a man, I'm prone to it. One or the other, I might get it. I might not, I pray so. But thank you for letting us know what to do should we see the symptoms and what to do to prevent it. I think these are the two keys that I'm personally taking away. And thanks to every SP member who happens to be here today, joining us to learn. The ladies have shown that they don't only care about themselves, they care about us as well. And that's why they gathered here to tell us what to do to prevent them taking care of us at our old age. And with that mention, I want to thank the DNI team so much, especially to the chair, Madam Shina and Amma and Rubabat, and also for Rubabat, especially for bringing her dad to come share his experience with us. We appreciate you so much, Daddy, and we've learned a lot from you. So this is what SP does. We go way, way too far to get what is needed for everybody, and this is one of them. We appreciate you so much, James, for taking up the mantle to host and moderate this session. God bless.
All right. Thank you very much, Dr. Revison Opon. Once again, let me reiterate our thanks to Dr. Douglas Ijapon, Mr. Abdul Rufai Oseni, and most especially to our distinguished diversity and inclusion chairpersons, in the person of Mrs. Shinawosu Ansa and her able deputies, Mrs. Amma and then Rubabat. Thank you very much for helping put together this session. We hope to see you again when we call upon you for our next or subsequent sessions. Thank you very much, everybody, and then do have a pleasant day.
Thank you. Thank you all very much.
Thank you. Bye.